Welcome to another episode where we review peptides and your endocrine health. Let's talk about BPC. So BPC-157 is a tissue repair signaling peptide. It's not a hormone. It's not a painkiller. And most of the data we have is preclinical, but the mechanisms are certainly plausible. There's information on angiogenesis, nitric oxide signaling, decreasing inflammation, increased tissue repair mechanisms, and collagen support. These mechanisms are biologically plausible for improving your response to mechanical load, like when you're doing workouts, you're exercising, or if you're having a lot of tissue injury because of your job or your overall daily physical activity. Decreasing inflammation is really important to improving your cortisol response. Decreasing that inflammation will also improve your insulin sensitivity, improve your blood pressure control, and overall make you feel better mood-wise, because inflammation is known to trigger mood issues too. I view BPC as supportive therapy, not standalone. And it's certainly not a license to go crazy with your physical activity or take reckless chances with your activity or your sports. It's really meant to be supportive when you are trying to engage in overall metabolic improvements alongside physical therapy or physical activity, as well as your overall metabolic health. This is the kind of peptide that we might use short term. Maybe you've had an acute injury after an event, or you are doing a lot of sporting activities. Maybe you've just done an event like a triathlon or a marathon, or you're trying to get back into the gym and you feel like your injuries are keeping you from being consistent. This might be the kind of peptide that we want to use in support of what you're doing with your goals, lifestyle, so that we can make sure that you're meeting those needs and your lifestyle goals. So this can't be done by itself. This has to be done in combination with, of course, lifestyle choices and overall hormonal health. But just an example of how we might use a peptide to sort of augment what you're doing to try to achieve those lifestyle goals.